Hi, thanks for checking out this episode of Living with Bad Plumbing. Today we're going to check out the CPAP, so stay right there. Now, if you've been diagnosed with sleep apnea, your doctor's probably prescribed a CPAP machine for you. And I'm going to show you some tips, or tell you some tips and tricks that I've learned, and a little bit about the machine. Now, as you see in the diagram, it works by blowing air down your windpipe into your lungs, and it keeps that continuous air blowing so the soft tissue in your throat doesn't close and shut off your oxygen supply. Now, research shows that continuous positive airway pressure decreases daytime sleepiness, especially in those who have moderate to severe sleep apnea. Studies also show that in people who have moderate to severe sleep apnea, nasal continuous positive airway pressure lowers blood pressure during both the day and night. The CPAP is better than other non-surgical methods for treating obstructive sleep apnea, and people with coronary artery disease who use CPAP for sleep apnea are less likely to have heart problems such as heart failure. Here are some common problems that people do have with sleep apnea. The first one being the wrong size. Now, you have to have a tight fit. A tight fit. You can't let any air get through this, or it's not going to serve its purpose. You have to get used to wearing it, even if you wear it during the day, just so you get used to it. It does work if you wear it. You also might have difficulty tolerating the forced air going down your throat. Now, it doesn't hurt or bother you, but it's just something that you have to get used to. You might have a dry, stuffy nose. For that, my doctor prescribed me a nasal inhaler or a nasal spray to keep my nasal passages open. Also, if you're claustrophobic, that might bother you. That's something that you have to get used to also. Like I said before, you don't want a leaky mask. You might also have trouble falling asleep. Ask your medical team for if they can prescribe you something for it, maybe some sleeping pills or maybe a good shot of whiskey. I use melatonin because it's natural and it knocks me out in about 30 minutes. You might have a dry mouth also, but a lot of the CPAP machines, they come with built-in humidifiers that you put in distilled water, and that helps with your dry mouth. Another problem that I had, I would remove it in the middle of the night and not realize it. I would take it off and I would even turn the machine off, and I'd wake up 2 or 3 hours later and it was gone. But that's just something from habit. Once you start wearing it all the time, that'll go away, hopefully. The noise from it might bother you also. Now, it's not a loud noise, but it's just like a respirator breathing kind of like machine. Time and patience is the key to success. You just have to wear it, over and over. That's all I can say about that. You just have to wear it if you're prescribed. Now, one thing that I did find that helped me a lot are these Breathe Right strips. They're for your nasal passages. My nasal passages, they clog up. They don't get congested. They just swell up, and this helps me. Once I started using these, it was a miracle for me. I could sleep through the night with my mask on. My wife says that I usually lay in one position all night and I don't move, and it's a very sound sleep. But when I don't wear it, I toss and turn all night, and I can feel it the next morning. I'm tired. This is what the nasal strip looks like out of the box. You just take the back, it's adhesive, and you take and you put it on your nose, and it opens up your airway passages. Well, that's it. That's my 30 seconds of CPAP education for you. If you have any questions or comments, please leave them, good or bad. I'm a patient, COPD and heart failure. I've had congenital heart defect, so all my life, so I'm kind of somewhat of an expert on it. If you like what you see, subscribe to our channel, check out future episodes. Hopefully I'm going to try to get them out every month. And that's it. As a good friend of mine, Joe Dirte, always said, life's a garden, dig it.